Welcome back. Our final guest today is Sean Johnson, Electronic Health Record Director at Sansum Clinic. Thank you for being here, Sean.
Thank you.
Let's start with you telling us a little bit about your role at Sansum and maybe your background. What led you to your current role?
Certainly. So I've been working in healthcare since 2000, working with electronic health records and installing them. But what really brought me back to Sansum was my dad moved to Santa Barbara in 1985. He was a psychiatrist at Sansum from 1985 until his retirement in 2007. And he was overhearing a conversation that Sansum was looking at installing an electronic health record. And he recognized the company that did the software that I install. And he just said to someone, my son knows something about that software. And one thing led to another. And we've been loving every moment of being back in town and in the community.
So what are the benefits of an electronic health record for patients and healthcare providers?
Absolutely, good question. One of the things that people focus on a lot is they think that organizations save a lot of money by not having to deliver charts around, by being able to reduce staff, and that's not the benefit. I mean, the benefit really is that every physician, every provider that you see has access to your information wherever they happen to be. If they're at a ball game, they can look on their phone, they can see the information related to the care they're giving you. If you go see an endocrinologist, they have access to your primary care doctor's notes. So it's really that access to the information inside of Sansum and between the providers that's critical. But on top of it is we're also interoperating with a ton of other systems that use the same software. So if you went to UCLA and you come back to your doctor here at Sansum, we have access to that information in the secure setting of the electronic health record. So it's that access that really is the key return on the investment of doing an electronic health record and having your information there.
Tell our viewers about MyChart and how it works.
Sure. So MyChart is it's the patient's version of the electronic health record, and it doesn't provide the entire electronic health record, for there's information that may not be as important to you as a patient, but it gives you a lot of information that you may need or may want to see on an ongoing basis. It has your results, your laboratory filings. So let's say you're monitoring your cholesterol and you want to see how your numbers look from last year to this year. You can look at it, you can graph it online and see if you're improving your health and if things are going according to your plan. In addition, you have access to your immunization record, your allergies, your medication list, a whole bunch of things that are just access to the information of the care you've been given. In addition, it connects you to the clinic. So you can ask your doctor a non-urgent medical advice question. So if you want to find out, clarify instructions from the last visit, or just ask a question if something's healing the way you thought it should. It provides you a way to send an email that's secure and it'll be responded to within 3 to 5 days. You can also request appointments. You can ask for a prescription refill. So it's really sort of connecting you to the parts of your record that are important with your clinical care team that's responsible for helping you.
That's great. Who are the most typical users of MyChart?
It's not who we thought it would be. A lot of people thought that the patient portal would be really just something designed for the young people who are really comfortable with smartphones. So we look at the patients who are signing up, and as of now we have over 60,000 patients that are live using MyChart. And we looked at all of those patients, and 40% of them, so over 24,000, are between 55 and 75, which that's also a good percentage of the patients we care for. And so the people that we need to be in closest contact with about their health and about their care are the ones who are really using the tool. We also monitor how many patients that walk through our doors are actually using MyChart. And as of February, 48% of all of our patients that come to the clinic are using MyChart. So we think it's good. We never think we'll be at 100% because it's not a tool for everybody. If you don't check your email regularly, it's not the tool for you, because we move a lot of communications from mail and telephone, and we ask you to go to MyChart and we'll communicate with you that way. So if you don't use email, it's not a good tool. But I do think that more than 48% of people are really comfortable with email and with iPhones and Android phones. So we think there's more that we could do to reach out to the populations who could still use it. And so anybody is really a good candidate for the system.
And when did Sansum implement MyChart?
Back in 2011, we actually went formally live. So our first clinic that went live on the electronic health record, that same day we started setting up patients on MyChart. And
So.
we've been having internal contests, marketing campaigns to try to get the word out about the benefit of using MyChart to access your providers and your care. It's been helping a lot. A funny story, my mom was up in Portland and she was seeing a doctor for a heart problem that she had. And no one knew what to do or how things could work. It was a Friday afternoon. But that physician up there, because she mentioned that she was a MyChart patient, and they realized that they used their own version of MyChart up in Portland, they accessed her records, they saw her cardiologist's note, they saw what her plan of care was, and they knew what to do in the emergency room to help care for my mom. And it's that kind of thing that makes, why MyChart's important, why using electronic health records is important, that it seems critical. I mean, it helped my family, if not everyone else. So
what a great story.
Thanks.
Thank you so much for being here today. This has been wonderful and greatly informative.
Great. It's been a lot of fun. Thank you.
Thank you. And thank you for watching. Until next time, this is Community Connection, keeping you informed.